Is pain normal during sex?
Pain should never be normal. So I think people always make this assumption, right? Like, oh, it's okay, have a glass of wine, or you can have sex and the first time will be painful. It shouldn't be, right? It's probably painful because you're rushing, or maybe you have actually an abnormality. Something is going on. Maybe your pelvic floor is abnormal. Maybe maybe you have endometriosis. Maybe there's a medical condition there that needs to be uncovered, but sex should not be painful. And, yes, sometimes there are like very large phalluses, which can be uncomfortable. And there are actually products you can buy that you can put on the phallus so less of it gets inserted. Sometimes you will see people have pain with that, or
in terms of the end of it hitting your cervix or something.
Correct.
Okay.
So there are some, obviously there's some cases where like you can't deal with anatomy. Maybe that's just not the right, that size is too big. That's okay. You can still address that. But otherwise, there should be ways for you to find pleasurable positions or comfort during sex. It should not be painful. And you shouldn't be rushing, right? A lot of people rush through sex and they're not allowing themselves to get lubricated. They're not allowing those changes to happen. And then if you do all those things, you're still having pain, see a doctor. Like there are lots of things that can cause pain and we can help you with that.
What is the truth about how you can have good sex?
So to truly have good sex, you need to be completely vulnerable. You need to first feel safe, of course, but then you need to be completely vulnerable to allow yourself to, completely experience the pleasure you're feeling, right? Because otherwise, if you're not completely vulnerable, if you're not completely there and present, you're not going to be able to experience the sensations you're having. You're going to be thinking about other things. So it's being vulnerable and being present, and that's going to allow you to have the best sex of your life, right? And that sometimes takes a lot of effort for people and a lot of energy and actual work towards getting there, but it's worth the work, right? Because you want sex to be a good experience. You want it to be fun. You want it to be transformative at times. And so actually taking the time to sort of like, work through the kinks of sex, which is, I think a lot of times we're like, oh, how do I even talk about this? How do I bring this up? Things are not perfect, but like, I don't want to hurt anyone's feelings. We're a very polite society, right? And it's like, no, this is something that takes work. Just like hard conversations in your relationship have to happen, conversations about sex occasionally need to happen.
So now, do we even know what kind of sex that we want?
Well, some people do and some people don't, right? I think it starts with self-exploration. And so I think people, have very different preconceived notions about that. Like men, it's very common to have self-exploration, and women, it's sort of variable. Like some women will be in their 20s before they've tried any self-exploration. Some women have never tried it at all. So I think ultimately actually, first of all, figuring out what you like. And that can be with partners too. Like, if you have a partner who's experimenting or you've had multiple partners and you've sort of figured out what you like, but it does take a little bit of identification first. And then about having the conversation, right? I think people think I'm going to have one conversation, it's going to be done and it's going to be great, right?
Yeah.
Or I'm going to try to have a conversation, it doesn't go the way I want to, and then that's it, I'm never going to try again. But it's not like that, right? It's going to take multiple conversations and it's going to be, awkward for both of you because no one taught us how to talk about sex. No one taught us how to have sex, first of all, right? You remember sexual education in high school or elementary school or middle school, wherever you learned it. But like no one taught you how to actually mechanically have sex. So that's one thing. And two, no one taught us how to talk about sex unless you're in a very progressive household. And so you're like, okay, you're going to have this conversation. You're both going to feel awkward. Someone may shut down. And that doesn't mean that it has to stop. It just means that like you're going to try again another time. And you're going to say, okay, let's have a conversation outside of the bedroom. Maybe it'll be more comfortable if we're sitting in a car so we're not staring at each other, or we're going for a walk so we're not staring at each other. And then we can talk about like, hey, let's just have this conversation. Let's do our best to be open about it. I want to talk to you about what I like and what I, maybe would like to try. And I'd love to hear the same from you.
So I just want to make sure, Dr. Rena, I have really extracted what I'm doing. Mm-hmm. So you said, don't have the conversation in the bedroom. Mm-mm. You might want to have the conversation while you're both focused on something else, like you're taking a walk, you're side by side, you're talking and walking. You're not necessarily doing the death stare at each other, so it doesn't have to be so intense. What is the opening line? Like, how do I get into this?
So you could, there's a few ways to do it, right? You could say like at some point, be like, hey babe, I'd love to have this conversation with you at this time, at this day, or like, or at some point, and maybe let them offer a time, but say like, I'd really love to just carve out some time where we can talk about this. So you're a little bit
sex.
Yeah, about sex.
Okay.
And just say like, so you're primed a little bit, right? Like we're going to have a little bit of a charged conversation. I don't know where it's going to go, but like I really just want to make our sex life even better, right? Or even greater. And
well,
like,
I think that's a great lead-in.
Yeah.
Like I wouldn't prime my husband because I think he'd panic that he's doing something wrong. But I love the thing where you're like, okay, we're driving a car, we're on our way. So, hey babe, I'd love to talk about how we can make our sex life better.
Yeah. And honestly, like if they want to have sex and, say you're a female in a heterosexual relationship and a man hears, I want to have more sex or better sex, that's pretty exciting for them, right? They're like,
of
okay,
course.
Usually, I mean, not always, it's the man who wants sex more often than the female. Now that's not always the case. And it's not abnormal if a man wants sex less. Let's just preface that. But, more common, we see it that way. And so most people are going to respond to that quite favorably and say, let's talk about it.
Do you have advice about how you should communicate with your partner about when you want to have sex?
Yeah. So, I mean, I think this is an interesting question because, who initiates, right? Like,
This is a big issue with like, and I don't mean issue like we're in therapy about this, but this is something that I think my husband and I have gotten into you kind of notice who's initiating. And then you start to get mad about it. Or then you start to go, okay, well then I'm going to just not initiate and wait and see what happens. And that's clearly not a mature way to handle your sex life or your relationship. But I'm going to turn it back over to you before I share too much about my marriage here.
I think, in terms of like initiation, right? I think one is like, is it that they're initiating when you're not in the mood, or are they initiating in a way that is not attractive, right? Like there's like, are they just grabbing you, or like they're just doing something that like they think is playful, right? They're not trying to be gross. They're just trying to be playful and like get you in the mood. And that's how they're communicating. And that might not be your communication style. So one is like, where is the issue there? And like, maybe it's hard for someone if it's always the same person and they keep initiating every single time and you keep saying no, like it becomes very difficult to keep initiating. Yeah. And then they're waiting for you. So sometimes I'll tell people like, okay, one, you got to sort of figure that out. Like, why, like if you're always saying no, you're turning them down quite often, like, why are you, like, think about that. And then say like, how can I make it so that I'm more receiving of them? Like, what are they doing? Or what time? Maybe it's like, you're not a morning person and like they're always ready to go in the morning. Like, you have to communicate that with them. Or maybe it's the way they're approaching you. And then, vice versa, you sort of like, it's good for both partners to initiate, right? I think it takes courage, it takes effort, even in long-term relationships, to like disrupt someone's day and be like, hey, I want to initiate. And the other thing that I think about initiation that's important is that desire is not always spontaneous. So what we see in the movies, right? Like people see their partner, they get really turned on, they immediately want to have sex.
Right.
That's not normal for a lot of people, particularly in long-term relationships. It's like when you go to the gym. You don't always want to go to the gym, but
Never.
once you're there, you're glad you did, right? So same thing with sex. Sometimes you have to initiate, let yourself be in the moment, and like, oh, you start touching each other. You're like, oh yeah, I like this. But you didn't, like when they started, you weren't really in the mood. But like, you started cuddling, started touching, like, oh wait, yeah, I like this. Okay, oh, I'm in the mood, right? That's responsive desire. So there's sort of a different way to think about it. It doesn't mean that you don't want it right that second. It may just be that you need to be warmed up and in the mood, and then you'll feel the desire. And then you'll be like, okay, yes, I'm ready to have sex with you. And maybe that'll work sometimes and sometimes it won't, but it's completely normal in terms of desire to have it come after the initiation sometimes.
To your point of thinking about it as play, like
it's really important to prioritize your sex life if you want it to be a priority, right? So like actually making time, like think about when you were younger and used to go on a date, right? You would say, oh, we're going to see each other Friday. I'm going to get all ready. I'm going to shave my legs. I'm going to do my makeup. I'm going to make sure like, oh, we might have sex. It's sort of exciting. So you have something to look forward to. And it can actually be really, really fun to allow that to be a thing. And the other thing about timing is, our hormones fluctuate throughout the day. So in the morning, between 7 and 10 a.m. is when testosterone is highest for both men and women, but more so men.
Oh.
And so testosterone is the hormone of desire. So very often people will actually feel more desire in the morning. And so that's not unreasonable to utilize your hormones and use them to your advantage. Like, okay, we're going to schedule time in the morning because we're both going to be sort of like able to receive because we have more hormones on our side.
Yeah, just don't put it in the family calendar as mom and dad are banging right now. Do not disturb, right? You got to have like a code name for it. Walking the dog. You know, something that is like.
Or like on date night, have sex first. Don't go out to dinner first.
Ooh, I like that.
Yeah. Yeah. So have date night, have dinner, whatever you normally do, but have sex first, right? Don't eat a ton of food, get bloated, drink a bunch of drinks, then you're like not even able to like really.
Right. And then a lot of us then are driving home and start arguing about something stupid. And then we just like storm into the bedroom. That's a genius idea.
Absolutely.
Yeah, that's the appetizer.
Yeah.
Each other. I love that. What are some of the most common sexual insecurities, Dr. Rena?
So we've touched on a couple of them. So for women, it's vaginal odor is pretty common. And then body image insecurities. So like breasts or butts. And we find that this actually is very common in younger women. And as they age, those insecurities get less and less for a lot of people because you're more comfortable in your own body. You're more comfortable talking about sex or knowing what pleasure is for you and what you need to achieve pleasure or orgasm. But those are very common. And then other ones are like, particularly when you're younger, is like being inexperienced or being like making noises or things like that can be sort of pretty common insecurities. But like I said, sex is play. There's going to be noises. Like you're going to have a queef or you're going to like, there's going to be some weird noises and that's okay. It's like, it's normal. It's your body's going to make noises when you're doing these activities, right? And then for men, most commonly it's penile size. So they're worried that like, one, am I normal? And two, is it going to shrink with age? And then they're also worried about ejaculating too soon. So those are sort of the most common insecurities.
Does the penis shrink with age?
Yeah, so not exactly. It can shrink commonly. It really depends. So one is you gain weight. A lot of men gain weight. And then as they gain weight, they're seeing less of their penis because there's weight on the mons, which is that area right above the penis. That gets fatter. So they're seeing less penis. So that's one.
So it's like an optical illusion.
That's one, yeah.
So the penis didn't actually get shorter.
They got bigger.
Yeah, you got bigger. Oh my God. That's a very delicate way to say that, but okay.
But it's, it happens. And then two is if you smoke, it can shrink. Because smoking can change the collagen content of tissue. And so it won't be as flexible. So sometimes, men are showers or growers. Some people who are growers, meaning like when they get an erection, they grow quite a bit. That will become less prominent because their tissues are now less elastic from all the smoking. And then if you have erectile dysfunction, you can actually get that decreased blood flow to the tissues can cause scar tissue or fibrosis. And that's like very like delayed. So not very early on, but if you're not getting any erections at all, over time, you can develop scar tissue and then that can shrink the penis.
Can a man ejaculate without an erection? Like if you think about a lot of men that start to struggle with testosterone or prostate issues and they can't achieve erection, can they still ejaculate?
Yeah, you can orgasm. You can ejaculate.
You can have an orgasm without an erection as a man?
Exactly.
Wow.
So you just stimulate. The erection is important for being able to penetrate, but you can still stimulate the penis and the genitals without an erection, right? You can use other types of sex to stimulate the partner, and then they can still have an orgasm. They can still experience pleasure, but they won't have the optics of having an erection. And that's very mentally tied to orgasm. So very often it's difficult for men because they're like, I don't see an erection. I'm not aroused. I'm not mentally there. So that takes a little bit of training and work to sort of be like, okay, I'm okay with the fact that I'm not getting erections. We can still achieve pleasure, but you need to, again, the same things, be vulnerable, be present, be mindful about what's going on to achieve an orgasm without an erection.
What should you